Well, thank you. Good morning, everybody, and good afternoon for those on the East Coast and Central Time. My name is Ellen Pliska, and I am the Senior Director of Family and Child Health for ASTHO, or the Association of State and Territorial Health Officials. We're excited to be kicking off the Breastfeeding Learning Community, and ASTHO and CDC's Division of Nutrition, Physical Activity, and Obesity, also called BNPAO, are partnering on this project to further explore the role of state health agencies in developing and implementing policies and programs that support breastfeeding. So I wanted to take a minute here to introduce our team. Again, I'm Ellen Pliska, Family and Child Health Senior Director, and I'm going to turn it over to Gabby, who is Gabby Garcia, Director of Maternal and Child Health, then Ify Morty, Maternal and Infant Health Improvement Director, Harper Schwartz, who's the Analyst in Maternal and Child Health. So we're very excited to be here with you. We have an exciting webinar today. You'll be hearing from our first presenter, Carol McGowan, who's from the CDC, who will provide a national perspective of the learning community. And you can see her smiling face up in the top bar there. So you can wave if you'd like, Carol. We'll also follow that with the ASTHO team to provide an overview of our learning community model. We'll then have a state time for introductions and information sharing, where we'll hear from our second speaker, Leah Minton, who will present on approaches to gain provider buy-in and strategies for messaging providers. And finally, we'll discuss our in-person meeting, which will be taking place July 30th through 31st in Asheville, North Carolina. So some of our desired outcomes for today's call are providing an overview of our learning community model, providing a national perspective from CDC on the goals of our learning community, introducing state teams and your project goals and topics, and discussing Hawaii's approach to gain provider buy-in. We'll also summarize the ASTHO Breastfeeding and Early Nutrition Innovation and Sustainability Convening, which will be happening on July 30th and 31st in Asheville. So with that, I would love to turn it over to Carol, who is the Acting Deputy Branch Chief for the Nutrition Branch in CDC's Division of Nutrition, Physical Activity, and Obesity, or DNPAO. As a reminder, you can find Carol's full bio in the chat box. And with that, I will turn it over to Carol. Carol?
Thank you, Ellen, and hi, everybody. Can you hear me okay?
Carol, we can hear you just fine.
Oh, okay, because my light shows that it's on mute, so okay. So hi again, everybody. Sorry about that. I thought I was on mute, but it looks like I'm on mute. But anyway, so I just want to really welcome you to this first learning community for this next 4 years that we have going forward this year and the next 4 years going forward. And for this, just want to mention some things I mentioned to those of you that were in Atlanta for the training that we had for the grantees or for the recipients, that for this 5-year cycle, as you know, instead of being able to fund all 50 states and the District of Columbia for breastfeeding activities, we were limited to a much smaller number. We received so many well-written applications for these funds, as you can imagine that all the 50 states and DC did apply. The states that got funded, which is you, rose to the top as the best of the best. So congratulations, and way to rise to the top. There's 16 of you, span states. One of the things that the DNPO leadership requested of all of us was that we find a way to provide needed resources to our funded recipients, or you. And for SPAN specifically, we decided to provide you with the opportunity that we had for a previous project that we funded through ASTHO, which was for 18 states and DC, and those 18 states include a couple of you as well, for those previous 4 years. ASTHO used those 4 years to work with states to build, test, and implement a learning community model. It was so successful, and that based on those results and the lessons learned and the resources that came from that work, we decided that it was a really good model to implement this time. What ASTHO will be doing in the next 5 years of this round of funding is supporting a learning community among you, as you know. This is way beyond technical assistance. And I know when this was first presented to you by your project officers, it was presented as a technical assistance opportunity. And I know that some of you said, well, we actually have pretty good capacity in our states and technical assistance is not what we need. So this is, I'm hoping I can clarify that a little bit. We know that you were funded because you demonstrated in your applications that you have the capacity and a high level of work already going on in breastfeeding. Technical assistance will be provided based on any needs identified and based on requests from you, but much, much more than that. Our expectation is that and I'll get into it in the next slide, but first, our expectation from this work is that we'll see some sort of measurable impact from your work. We've received requests as far up as Congress to document the impact that the DNPAO funds have had around the United States. And we need to be able to document your work, its reach, and the benefits that are derived from this work. So if you could go to the next slide, please. So like I was saying, this project is beyond technical assistance. What you have here is an opportunity to be able to get together as a learning community, to share ideas and resources, to problem solve, to ask each other questions, to let us know what resources would be most helpful to you, to let your sister states know that you have resources that they can use, or to ask if you can use theirs, to mentor each other, all things that ASTHO is going to be going over with you over the next 4 years. It's also an opportunity for you to shine. And this means that what you accomplish can then be used not only to highlight the work that you do, but to be used by your sister states who were not funded, but are also continuing to do breastfeeding work and would like to learn from your successes. So again, as I was saying earlier, we've received requests to justify the use of our funds. With only 16 states funded, and you 16 states are actually funded at a higher level than we were able to fund states when we funded all 50 states. There are also some really high expectations for accountability from you, and accountability primarily from us for investing the funds in you. That we should be able to demonstrate that by investing a certain amount of funds in states for work and prevention in terms of nutrition, physical activity, and breastfeeding, that there will be a payoff that Congress can measure the value of what they've invested as well. So, and in the end, also, it's critical that through your work, we continue to build practice-based evidence because we have to demonstrate in this field that the work that we're doing in breastfeeding really is an investment for the future of the families in your communities. And with that, I'll turn it back to Ellen. Thank you.
Thanks, Carol, and everyone. This is Efi with the ASTHO team. Thanks, Carol, for the overview and providing that national perspective. And so, for those of you who are at the DNPAO training, will obviously know about ASTHO, but then I'm just going to provide a little bit more details about ASTHO and who we are. And so ASTHO is the national nonprofit organization representing public health agencies across the U.S., U.S. territories, and freely associated states. And our members are the chief health officials, also known as the state health officials or commissioners, who lead the health agencies in each of these jurisdictions. And they are dedicated to formulating and influencing sound public health policy and ensuring excellence in public health practice. And so ASTHO has 3 strategic priorities that we work through to achieve our mission, the first being leadership, the second advocacy and policy, and the third capacity. And so it is through these that ASTHO empowers states in their leadership role and advises or educates members on policy and provides technical assistance and guidance to their efforts to improve the nation's health. And so, as you all heard from Carol, we had this the learning community model and had implemented that back in 2014. And so this model is essentially a unique one that helps to build your capacity, so state health agency capacity for breastfeeding promotion and support through 3 core strategy areas. And those are improving maternity care practices for breastfeeding in hospitals or birthing facilities, 2, improving continuity of care and peer and professional support. And the third is workplace compliance with federal lactation and accommodation law. And so over the course of the 4 years that the first cohort of states had worked, that's from 2014 to 2018, we used the learning community model to support 19 states, including DC, as Carol had mentioned earlier. And they were able to pilot and enhance system-level strategies focused on policy, data, and strategic partnerships, which were designed for maximum potential to be sustained and spread across the state. And so in that time, states worked collaboratively with their breastfeeding coalitions, task forces, or hospital associations. And through that work and through the learning community, there were peer-to-peer learning opportunities, as Carol had shared earlier, where states were able to collaborate and learn from each other. And so, as you know, we'll be continuing this learning community model to support all of you who are the next cohort of states, so the SPAN recipients, to document the collective impact that you all will have, and then also to provide that platform for you to learn and share your knowledge and best practices with each other. And so SPAN recipients will be working on advancing the breastfeeding work through one or more of the 3 strategy areas that I had mentioned earlier, with 10 of you having selected maternity practices and birthing facilities, 12 of you around continuity of care and community support, and third, 11 of you choosing the last strategy, workplace compliance with lactation accommodation law. And so I'll turn it over to Harper on our team to share more details about our learning community model.
Thanks, Ify. So I'm now going to provide further information on our learning community model activities. So again, this might be a refresher for some of you who've already heard this, but for those of you who this is new, it's really exciting all the different options we have. So first, we have virtual convenings or webinars like this today that provide a platform for expertise and information for states. So again, it's really an opportunity for ongoing engagement, training and sharing, and for peer-to-peer information exchange and dissemination of best practices. So we will have about 4 webinars per year. Second, we offer technical assistance, or it's also known as ASTHO STAT, which includes a range of technical assistance options designed to support health agencies with the development, implementation, and evaluation of a programmatic or performance area. So we have 3 types of ASTHO STAT. We have on-demand technical assistance and referrals. We have trend analysis and research, and finally we have on-site or virtual technical assistance and expert consultation. Next, we also offer innovative project grants, which will be us providing support for up to 5 states for innovation projects that will inform the field and add to the practice-based evidence. So these projects should focus on 1 or more of the 3 priority areas and on the decrease or elimination of breastfeeding disparities. And we will be releasing more information about this shortly, so please stay tuned. We also are currently conducting a landscape analysis of how states are incorporating and sustaining statewide breastfeeding support efforts through policy systems and environmental changes. So thank you again to those of you who have filled out that pre-assessment questionnaire. It really did help us capture baseline data, skills gaps, and it will allow us to move forward with our analysis. We are also conducting key informant interviews as part of this landscape analysis. So these key informant interviews will allow us to take a deeper dive into state efforts and to better assess the current breastfeeding landscape as well as track policy change. Previously mentioned, another key part of this learning community is peer-to-peer information exchange. So as a part of this effort, ASTHO will establish and maintain mentor-mentee relationships between states working to implement and advance breastfeeding efforts. We are also conducting routine legislative tracking on how states are incorporating, leveraging, and sustaining statewide breastfeeding support efforts through policy systems and environmental changes. And finally, another core part of this project is evaluation. So ASTHO, we have an internal evaluation team that provides research and evaluation capacity and support ASTHO-wide. These evaluation assessments allow us to monitor effectiveness and quality based on your user feedback provided by you all, the participants. And this allows for continuous quality improvement of future webinar sessions as well as program activities. So next, we want to share with you all some resources. So on our website, you can find breastfeeding resources developed by both ASTHO and our partners. This includes past webinars and deliverables from our previous ASTHO Breastfeeding Learning Community. There are also multiple resources and case studies on topics including partnerships in action, breastfeeding in hospitals, breastfeeding in the workplace, breastfeeding peer and professional support, and breastfeeding laws and policies. We will be updating this throughout the learning community, so please make sure to check back in for more resources. At this time, we are going to move into state team introductions. We will be going in alphabetical order, and we ask each state to discuss the following. You'll also see it on your screen there. So one specific project goal your state aims to accomplish through this project, one breastfeeding topic area of strength, and if applicable, one technical assistance need you may have. So we can go ahead and get started. I saw that Alaska joined the webinar. I'm wondering if you all are on, who's on from your team, and if you would like to share a few words.
Yeah, this is Dawn. Can you hear me?
We can.
Okay, yeah, hi, this is Dawn from Anchorage, Alaska, and we are in a great position as far as our project. We're implementing the excellence in care with 10 steps in 10 different hospitals in the next 5 years, and we're going to each hospital twice. And I feel what is really beneficial to us is that we have some historical knowledge with this project. This project was something that the Women, Child, Family Health Department had been working with, and so we were able to reach across state government silos and pull that partner in, and she has been instrumental with developing this program, and I think we're really doing good, and we're going to hit it out of the park.
Great, thank you so much for sharing and for joining us today. Next, I don't believe Anne-Marie you're on, but I just wanted to double check. Okay, we'll go ahead and move on. I know Linda from California won't be joining us, but I just wanted to check to see if Jackie would be on. Okay, we're breezing through these. Colorado, Stacy, I saw your name. Not sure if anyone else is joining you, but feel free to go ahead whenever you're ready.
Hi, can you hear me all right?
Yes, we can.
Okay, good. You know, the whole docking station thing doesn't always work well with Clubhouse, so I wanted to make sure. So hi, yeah, I'm Stacy from Colorado, and our main focus probably is we're actually working in all three of the areas that the stand ground is covering, and our big focus is on increasing the number of maternity facilities in Colorado that are baby-friendly, designated or on the pathway. So we have the Colorado Baby-Friendly Hospital Collaborative, and we have a lot of great resources and technical assistance available through that. And then that's probably like our big goal, is to try to just increase our numbers. We're over 40% of our live births right now occur at a baby-friendly facility. And so we're hoping to push that above 50%. And then an area, kind of our topic areas of strength, are we have a lot of really awesome toolkits now available for the state. We have a child care toolkit that's specifically for child care professionals and providers. We have one for centers as well as one for family home providers. We have a breastfeeding friendly medical office toolkit and a breastfeeding friendly employer toolkit as well. And if anyone is interested in those, we do share those with anyone who would like to take them and adapt them. And I think so far, Connecticut and North Dakota have both taken the child care toolkit and adapted it. So it's really cool to see it adapted and changed. So that's kind of our area of strength. And then the fact that we already have an established Colorado Baby-Friendly Hospital Collaborative with 24 member hospitals is also one of our other areas of strength, is that we've been doing this work for the last 5 years, and we're just hoping to continue to expand it and get more hospitals bought in. And that kind of goes into my TA need, is I need any kind of help or resources that people might have for reaching those hospital leaders and getting them bought in, because that's where we're really struggling, is getting them bought in and then keeping them bought in. So the whole idea of improving their hospital maternity practices.
Wonderful. Thank you so much for sharing. We're going to move on now to Connecticut. Jen, I think I saw your name pop up. Are you on as well? Okay. We can always circle back, Jen, if you happen to step out or if you're on mute. But we'll move on now to Illinois. Catherine, I believe I saw you had signed on. Are you available to speak?
This is Jana from Illinois. I think we're both on, and I'm not sure if anyone else from our team is also on, but I can speak. Okay. So, hi everyone. This is Jana. We're the Illinois Public Health Institute. Our breastfeeding strategy is focused on continuity of care and community support, and our big area right now is we have. I think our strength is we have a lot of partners working with us on this, and we are really using a learning collaborative model here as well. So doing learning collaboratives around local work to improve continuity of care across the state. And so we just kicked off our learning collaborative last week. And I think there's a lot of really engaged partners. I think a technical assistance unit is just as many examples as possible of engaging people when they have very few resources for making change. You know, we aren't able to provide stipends necessarily, at least in our current year budget, but very little sort of financial support. And cuts have been being made to, you know, peer counselor services and things over the years. So trying to figure out what can be done with few resources, and the more examples we have of that, the better.
Great, thank you so much for sharing. I don't believe Kentucky is on, so we will go ahead and move on to Minnesota. Holly, would you like to share a few words?
Yeah, sure. This is Holly Globitz, and I am working in the state of Minnesota, and I just want to say, Stacy, I will back up your feedback about your stellar child care breastfeeding toolkit, because we have looked at it as well, and it is wonderful. But we're actually going to be working with maternity centers, with the continuity of care, and with workplaces. Right now, we have a breastfeeding friendly health department designation that incorporates some continuity of care throughout communities where our local public health departments work. So we are going to be developing a learning collaborative with local public health partners who may have either low initiation rates or low duration rates, or they have high initiation rates, but then at 6 months, their duration rates drop drastically. We're still kind of feeling that out as to who we're going to invite in, but we do have quite a few counties where we see quite a drastic drop off. So that's one key area we're going to be working in. One advantage that we have on the workplace front is that we have something called the State Health Improvement Partnership, where we work with local public health in all of Minnesota counties. And the local public health departments invite workplaces in their areas into a collaborative to learn about policy systems and environmental changes with workplace wellness, and breastfeeding is one of those areas. So we are going to be able to continue to work diligently through our local public health departments to promote workplaces, in particular manufacturers, manufacturing workplaces, low-wage workforces, low-wage employers in particular, to apply for our breastfeeding friendly workplace designation. So we're going to be able to really use the local public health departments as a delivery system for our work.
Great, thank you so much. We're going to move on now to Missouri. I saw that both Carla and Lisa are on. Either one of you can go ahead and share when you're ready.
Sure, this is Lisa. Can you hear me?
You can.
Excellent. So we are working in all 3 breastfeeding strategies. One of our big goals is working with hospitals to implement the Baby Friendly Hospital Initiative, or to be recognized as a Show Me 5 hospital. And we are holding a Mother-Baby Summit in September, where we will invite all of our birthing hospitals to bring leadership to come and learn about how to implement those steps. We work with Dr. Bobby Phillip out of Boston Medical on that. And if that is a goal of yours, I highly recommend working with Dr. Phillip. She has some funding from the Kellogg Foundation, and she is just amazing at helping with that. Let's see, in continuity of care, we're working on putting on a 45-hour course this year that we will invite WIC, nutritionists and CPAs, peer counselors, hospital nurses, La Leche League leaders, community members, doulas, midwives, everyone we can find that wants to come and learn about how to become an IBCLC or to give better lactation support in their community. And then on workplace compliance, we are working at revamping our breastfeeding friendly work sites materials to bring them more up to date. And then back to continuity of care, we're going to be working on introducing a breastfeeding friendly physician recognition. And then our TA needs, I think engaging hospitals is always hard to do when you're working at the health department. So building those partnerships is something we're working on, and reaching more of our rural areas with lactation support. Carla, anything you want to add?
We also have the child care toolkit and recognition program.
Okay.
Great, thank you both so much for sharing. We'll now move on to North Carolina. Catherine, I believe you are on if you want to share a few words and thoughts.
Yes, can you hear me?
Yeah.
Okay. Yeah, so Catherine Hill from North Carolina. Our project goals consist of all three of the strategies as well. Our main focus being the continuity of care strategy and increasing outpatient clinics that go for our designation, which is the Mother-Baby Award. Through that, we're doing some peer counseling and some text messaging with participants at these specific clinics. Others, we're doing worksite. We have a toolkit, and we're working on increasing the awareness of the toolkit and work sites that are being designated as a breastfeeding-friendly worksite in North Carolina. Probably our strength that we want to continue to work on as well is our breastfeeding-friendly maternity care centers. We have a North Carolina designation that is based upon USA Baby, and we have 81 designated maternity centers in North Carolina, and we want to continue to increase that and try to hit all of our counties in the state. I would say, kind of echoing, I believe it was Illinois, that kind of what can we do with few resources. A lot of our counties are more rural and don't have as many resources for some of these projects, so that would be a request as well.
Great, thank you so much, Catherine. New York was not able to join us today, so I'm gonna briefly speak on their behalf. They shared a few words to share with you all. So the project lead there is Connie Stefano. Hopefully I pronounced your name right. But they are working on strategy area 2 and 3. Their project goals are to increase the number of community sites, so healthcare practices, childcare providers, and baby cafes that support continuity of care and breastfeeding. Their other goal is to increase the number of work sites in compliance with the federal lactation accommodation laws. It shares that their strength is that they have 6+ years of experience in the area of assisting OBGYN, midwifery, pediatric and family practices in achieving the breastfeeding friendly designation. This work began with the establishment of a work group in October 2012, and it was piloted in Erie County in 2012 to 2014, and then expanded statewide. In terms of their technical assistance needs, they're interested in the development of materials to guide organizations in advancing health equity in their breastfeeding work. So with that, we can move on to Ohio. Jennifer Jones, are you? Oh, go ahead.
Hi, thank you. So for Ohio, we are focusing on improving worksite lactation accommodation for breastfeeding employees and increasing the number of sites that are complying with the federal lactation accommodation law. We're also working on a breastfeeding friendly designation for early childhood education centers and developing a new process for that. In terms of our topic areas of strength, Ohio has been very successful working on maternity care practices through our First Steps program. So we are now focusing more on work sites, which is an area where we haven't been doing a whole lot in the past. And in terms of technical assistance needs, there's nothing major at this time, but we'll be in touch. One thing would be tools and best practices for businesses outreach and engaging businesses for the worksite compliance.
Great, thank you so much. We're going to move on to Pennsylvania now. Kim, I think I saw you on the line. Do you want to share a few words?
Hi, yes, I'm here. Can you hear me okay?
You can, go ahead.
Okay, wonderful. Thank you. I don't know how great my connection is. So I wanted to just, I guess I'll start with the project goals. So I know I got to connect with a lot of you at the grantee meeting, but we're working on a Keystone 10 10-step program working with birthing facilities. And because this was a program that we actually got to, another bureau in our Department of Health got to start back in 2015. They really went through that work of recruiting and getting all the facilities on board, which we still, of course, have some of that to do. But we get to start out with some really great participation. The program actually covers, in the hospitals and birthing facilities that we work with, about 95% of births in the state. So we're really excited to be able to continue that program and expand it as well. So also, besides that maternity care focus, we're also looking at continuity of care through the Epic Best training for healthcare providers. And we've moved that from being an in-person training to also being something that's available online, which we've gotten great participation from as well. I would say a strength is the communication of the participating hospitals, and a lot of that is owed to our wonderful partner, the Pennsylvania chapter of American Academy of Pediatrics, because they've done a great job of building that network for a lot of hospitals and facilities that might not otherwise be working well together. They can all come together and have a lot of collaboration, and some of that is due to some actual collaboration meetings that we have as part of the program that happen once or twice a year, depending on the year and the funding, and gets together facilities in the region so that they can share with each other about kind of things that they've had to work through, and they really are very much open to that, and that's been very helpful. And then there's also an opportunity for speakers to come and talk about different topics, which they've really enjoyed as well. And as far as technical assistance, I would say there's nothing at this moment, but I know there will be, and I know I'll be reaching out.
Great, thank you, Kim. We can now move on to Texas. Leslie, I saw you are on. Would you like to share a few words?
Sure. So Texas here, Ashley is also on the call, and she'll start off, and then I'll finish us.
Okay, so we are working on all three of the different areas. And one of the things that we have been working on in the past was working with the WIC agency in Dallas on creating some trainings for the hospitals working towards that baby-friendly designation. And so we will be further expanding this towards a train-the-trainer model where they will be able to go to WIC agencies around the state and help them create partnerships with hospital systems in their local areas. And this will help both with facilitating that baby-friendly designation and then also with that warm handoff and working towards that continuity of care piece between the hospital systems and the birthing centers and some of those community organizations that provide support to mothers after they're discharged.
And so for the worksite piece, we're actually taking a look at our own agency and kind of going towards the model of being an agency that demonstrates the Texas Mother-Friendly Worksite certification. And so DSHS sits under the Health and Human Services Commission, which has over 45,000 employees. So we will be working with our Health and Human Services Commission to strengthen our policies and support breastfeeding mothers. Eventually, a statewide wellness coordinator will take that model and hope to expand it to other state agencies. As for topic areas of strength, I think we already have some great partnerships that have been developed with Dallas WIC, our maternal and child health program, and then we also house the Texas Mother-Friendly Worksite program at our agency. So that is just an abundance of resources and toolkits for just even private employers and for our other state agencies. As for TA, we don't have any at this time since we're in the really early stages of our project, but I'm sure we will have needs to come.
Great, thank you both. We'll now move on to Utah. Judy, I think I saw you log on. Are you on the line? Okay, we can always circle back if you join us later. We'll move on to Washington. I think, Michelle, you were on. You want to give a few words? All right, well then I guess we will conclude this section and I will turn it over to Gabby for what's next.
Oh, I'm so sorry. I didn't realize I was on mute.
Oh, no worries. Oh, go ahead, Michelle.
One of the benefits of being W on the list is I get to hear everyone else's work before mine. So similar to everyone else, in Washington State, we're doing all three of the project priorities. We've been doing this work since 2014 with the previous CDC grant, the 15, oh man, I can't even remember the number of it anymore. But one of our biggest strengths is our hospital program that we have. We have a really good relationship with the Hospital Association. And because of that relationship, we have created some really good work plans working with Joint Commission data, OBCOPE, and of course, utilizing MPINK data to do assessments of them and continue working with them. We have almost 60% of our hospitals designated as breastfeeding friendly or baby friendly, which is awesome. We also have a really cool, for work sites, we have a new law that was just passed in Washington State that provides lactation worksite accommodations for 2 years. And it requires all employers to provide accommodations unless you can prove undue hardship. And that is for employers of 15 or less. They have to prove undue hardship. So this means in Washington State, we're finally going to have people who work for nonprofits, people who work in agriculture, people who work retail and fast food. They'll finally be able to get the accommodations that they need at work. Another thing that we're going to be rolling out is with the SPAN grant that we're part of. We have local agencies that we're going to be working with to provide training in hospitals. And we're working with a few groups on that, but we're trying to also involve health equity into that training as well. So I'm really excited and looking forward to that. One of the sort of technical assistance needs I could see us needing is sometimes it's nice to have a first draft on something. So if, you know, the whole hive mind, we might be able to put together one-pagers or sample policies on something. That could be really cool. Another one that I could really see us needing technical assistance is with rolling out the new laws and accommodations in Washington State. We've done a really good job historically of making sure that, you know, work sites are providing the accommodations, but now it's basically going to be everyone that has to provide it. And in Washington State, we have such a diverse amount of employers. You know, we have Google and we have Boeing and we have like all these big Amazon up here, but we also have a lot of rural, we have a lot of agriculture. So what does, you know, worksite accommodations look like for everyone? And so, yeah, I'm hoping that the rest of y'all might be able to help support us in that too.
Thanks so much, Michelle, and to the rest of you states, it's great hearing about all the good work that you're doing. The next portion of the call, we'll be hearing from Leah Minton. Leah is currently providing lactation services at a baby-friendly hospital in Hawaii. She has certified nurse midwife work experience in home birth, private offices, and at a federally qualified health center, where she also precepted nursing, nurse practitioner, midwife, and physician assistant students. Leah is the board president for Breastfeeding Hawaii and the board president for Midwives Alliance of Hawaii. We'll save some questions until the end of the presentation, but please feel free to type in questions into the chat box through the presentation. And as a reminder, her full bio can be found in the chat now. Leah, whenever you're ready, please go ahead.
Okay, can everybody hear me?
Yep, you're all set.
Okay, cool. I just wanted to apologize in advance, two things, which is that I live in a very rural area and we've had some insane weather, and it's also peak traffic hour because there's only one road in and out, so you may hear some traffic noise in the background, and I may also lose power in which case I'll just speak to the slides over the phone, but I won't actually be able to see them. So we will do our best. I've actually already lost connection twice. So we can go on. I guess I'll just say something about this. So basically, I was just invited to come on and speak to you all, and I just really wanted to congratulate all of you for getting the ASTHO SPAN grant. And Hawaii was not one of the states that was selected, so I'm just on here speaking to those of you that are participating in it, and it's been really great to hear what you're all doing, which is amazing work, and we really look forward to seeing your progress, and also, of course, getting to hear about the hurdles that you overcame, because that's really where the learning experience comes from. And so this talk just kind of came out of a question through one of the email threads in like how to engage providers and encourage breastfeeding in physician clinics. One of the states was having some difficulty with that, and we had been asked about some of the work that we had done. And just to give you a brief idea of where we're at as a state is we are a 100% volunteer working board, and we have no state breastfeeding coordinator, and our WIC breastfeeding coordinator position used to be 0.5 FTE, and that was that position was cut. And so the work of breastfeeding within WIC has been absorbed. Of course, it's required by federal law to be done, but there isn't actually a designated position for that. And so they're also not part of our board anymore. Unfortunately, they don't have time. And so just putting it out there that we actually have no breastfeeding designated paid positions in the state. So we can go to the next slide. Okay, so for us, not only being a rural state physically separated by water within ourselves, but also geographically separated from everybody else in the middle of the ocean, we also are rural within our own island. So for example, where I live, it definitely occurs throughout the year where I'm actually trapped in on both sides and can't get out on a one-lane road that is shut down in either direction. And at the same time that all of our work is really concentrated in specific areas. And so that makes it oftentimes difficult for getting patients to support services. And what I can tell you is when I worked out in the F2HC out here in my community, I was the only breastfeeding support person out here. And since I left that position and work more where it's concentrated, there are no breastfeeding support persons out in my community. And so that really leads us to needing to think about how to collaborate with our rural areas. And so we really want to be a part of as many collaboratives as we can. And in Hawaii, we've created the Hawaii Maternal Infant Health Collaborative. There are many groups within that, one of them which is the Breastfeeding Working Group, and we have people from multiple islands that are a part of that and in different positions, some of which are paid positions, and their boss allows them to come to these meetings as part of their work, and others of us are volunteering our time to be a part of that. What we did is created a breastfeeding strategic plan, and then basically all of the work we're trying to do is addressing what's within that strategic plan and checking in with each other so that we're not working in silos, not only within our specialties, but also across our islands, because we are so limited in resources. We want to make sure that anything that people are working on, that then we're doing it collectively and kind of supporting that and using that. And so that comes into how to engage providers, because buy-in by providers is one of the hardest things. So this is just going to kind of go into one of the areas we worked on, which was trying to get more providers to either support breastfeeding and or refer out for breastfeeding, be aware of breastfeeding resources, things like that. And so we looked at different champions. Of course, we naturally initially looked at pediatricians, and as we know, the AAP has a breastfeeding section, and there's supposed to be a state breastfeeding chair for every state. Hawaii also unfortunately lost our breastfeeding chair, who used to be one of our board members. She passed away unexpectedly. And that left this huge gap in trying to connect with the pediatricians. And we really weren't getting much movement with them initially. And so actually what we found were dentists were really interested in the work that we were doing. And so we started focusing some effort on dentists because they were interested in talking about breastfeeding and supporting breastfeeding, as well as treating tethered oral tissues. So we kind of went down that road, and with that, we're able to tie in the pediatricians. So one of the things we reached out to, going back into that collaborative, is that there was a community organization of pediatricians that had a monthly lecture that they were like served dinner at, and they got credit for attending, and they got some incentives to the insurance company that was paying for this. And so we were able to, through basically connecting with one of them, able to come and present on breastfeeding. And that's where we realized how basic we needed to turn this breastfeeding presentation into. This included slides with pictures of bottles of like 2 ounces, 4 ounces, and 6 ounces of breast milk in it, and asking like how much they, like which one was too little, which one was good, and which one was too much. And they all felt like only the 6 ounces was enough, you know. And so really recognizing that they may not have been trained on what the normal amount of food that babies actually eat from breast milk and what's normal for moms to pump. So being able to do just some really simple little question and answer as well as educational points with that. So we did talk with community pediatricians, and that kind of brought them into being interested in hearing more, because we did it in a humorous way rather than any type of standard lecturing way. And really doing a lot of, we know that you've come across these things, and you know, when people say something, you know, we'd give an example of something outrageous, right, just so that they would laugh, essentially, to bring them in. So that's where then we were able to find some client champions to then kind of persistently bring things up with their pediatricians to kind of put a bug in their ear. And that brings us to the next slide. So we wanted to find out, like, okay, what is going on with this resistance to provider buy-in? And one of the things we were looking at is, okay, we want to have breast milk across all of our islands. We want to ensure that all of our keiki are getting breast milk as their first food. We're really pushing it more in the first food movement, and culturally bringing back breastfeeding, looking at the multitude of cultures that we have here, why some breastfeed at much better rates than others. And so we really needed to get into, like, what are the issues that people have? And so part of that is developing questions that get to our overall goals. So rather than thinking about, like, what's going to help a provider learn about breastfeeding, we just want to ask, you know, some questions, which you can go to the next slide, of thinking about different ways to approach them. And that may be through survey monkeys or phone calls or through support groups or home visiting, whether we're asking providers, clients, lactation consultants, things like that. We were at a meeting with some pediatricians, and we just made stickers and kind of asked them to pick their favorite sticker, and we'd already pre-counted how many were there, and then we're able to see how many were left, so that even gave us data on, like, what people were kind of trending towards. And if we go to the next slide, that has some of our, like, sample questions. And so we looked at a variety of different groups and just trying to understand what the issues were. And what we want to do is how best to support the pediatricians or OBs or family medicine physicians, things like that, in helping parents to achieve their infant feeding goals. So what do providers need in order to achieve, to help their clients achieve their infant feeding goals? And what we really found out, like, we only interviewed about 20 total out of all of these people, because after a certain number, you're really going to start to get similar things. And so that's where I was saying in the previous slide, not to focus on large numbers, that it's okay to just go out there, get some information. And then from that, we did some prototyping and created some tools. And we reached out to providers and just kind of said, like, what do you think about this tool? Would this be effective, or that tool? And by giving them something to look at that was tangible, then they were able to say, no, I don't really like this. I would want something else that's this, 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 and this. But if we just ask them what they want, it's hard for them to create something that's abstract from it. Versus if they're looking at something tangible, then they can give a lot better feedback on what might be helpful. And so with that, we then were able to create just some tools to kind of help them. And we can go to the next slide, which kind of goes over some of the tools that we did. So we created a passport, which is modeled after the Vermont Loving Support Checklist. We kind of combined both, because the Vermont Loving Support Checklist really was geared more towards WIC clients. And we realized, okay, well, that's a population that kind of comes in. But if we're dealing with people that are bouncing through multiple providers, they see their OB provider, they may or may not get breastfeeding information, you know, prenatally, then they're seen in the hospital, they get information there, and then they follow up with a pediatrician, then they're seeing a lactation consultant. And so who's following all this information and how do we put it all together? That's where we kind of looked at that as something that might be helpful in their journey, and that providers also can be prompted with, because we realize providers don't know a lot of this information. And so that it was a way to help provide providers with a resource that gave them also information that also helped their clients. And so there were other things we're looking at. I know some of the states, you know, pay for like Pacify services, may have developed apps that, you know, clients can use, that kind of a thing. So we can go to the next slide. And we'll just kind of pop through these quickly. This is just an example of our passport that kind of has the contact information. This is the back side, you know, when they'll check in, that kind of goes over what's not normal, because realistically we found a lot of providers think that cracked bleeding nipples are normal, and that they're just supposed to go through that. So we want to help say what's not normal as part of a teaching moment, as well as giving them resources so that they're comfortable with knowing those. And then next slide. This is kind of the checklist inside. And, you know, we did some tests with it because it seems like a lot, but if you really just stick to each box, then people said it wasn't overwhelming and it was helpful for each section. And so, you know, it really was, for example, like in the pregnancy section, I do not have breast pump coverage. I can get one through WIC, or I know where to rent one, was like a prompt of, you know, as well as I have breast pump coverage through my health insurance. My provider gave me a prescription. I know where to get one. Was a prompt for providers, because I can't tell you how many people show up to our hospital and haven't gotten their prescription yet. And providers are like, oh, I have to write that. So it's like a way to engage the provider in a gentle way, as well as the fact that they really didn't know a lot of these healthcare conditions could cause concerns with milk production that we listed as I have one or more of the following conditions that may affect my milk supply. And so, you know, that was just a way to like help teach providers and get them minimally competent while being able to go over things with their clients. So next slide. And then, so this is where like finding that buy-in. So first we did like we offered a skills workshop modeled after North Dakota's skills workshop, and we did it right in the community, and we invited everybody to come. And what we saw is that none of the pediatricians came, but they did send some of their staff. So that was really good. You know, that showed us that they feel like they don't have time to learn this stuff, but they're invested in having their staff learn it, and we're happy to do that. So that's also where we did some community guest lectures, like I talked about earlier. And then what we did is, because of that buy-in from the dentist with interest, then we brought Dr. Gahary to come and do a tongue tie lecture, and what we did is we actually did we did one as Breastfeeding Hawaii in order to invite everybody, but then we went to we utilized our relationships with the dentist as well and to then get into also with ENTs, and then we were able to connect with some pediatricians at the university, and so we were able to say, okay, we're going to partner with the university in order to get him to do a grand round. That way we're going to meet providers where they are so that they're not coming out of their hospital, and we're going to get pediatricians, ENTs, residents there. And then also we were able to connect that at the same time with the Hawaii AAP semi-annual conference, so that then we were also getting him where the pediatricians were all going to be for the most part. And so that was huge because they weren't going to come to our conference. The lactation consultants and nurses come to our conference, but the providers don't, even if we get CME credits. And, but they do go to their own. And so it was more so of investing in putting work into placing the education we wanted in their own events that they attend. And then that's also where I'm just bringing up considering maintenance of certification Part 4 projects for credit. So breastfeeding definitely could become a project that then if you tie into one of the sponsors within your state that offers MOC Part 4 credits, that your organization or an organization identified could take the lead on doing that project, but that the information is and implementation of that project is done through the providers' offices, so that then they're getting credits for their certification, which is what they need. And so that kind of led us to like, does it have to be providers? No, it doesn't have to be the provider directly. It can be staff members within that and within their offices. And so that also came into like one of the resistance from providers is that for us, we had a change in how they were being reimbursed, which is through, I just lost the word, payment transformation. And basically they just get one set price per patient on their panel. And so that means that they don't get paid for pay for performance, right? So every time that they see a patient, they're not getting paid for each service they provide. So it's not actually a billing incentive for them. So understanding what's happening in your area of how pediatricians are being reimbursed would be really important. Next slide. And then this is just to keep it simple and straightforward. What we really came down to is like, we created a centralized breastfeeding resource, one link that we can provide everybody, which many of you probably already do, that has all of your state resources in it. Quick little tip sheets. These are just some easy ones I found online, just as like examples, which is that it's super simple for them to just look at, as well as if you're just saying, in this section when I have here, when to refer, be clear, that's part of having a visual aid they can either put up in their office that they can refer to that just has these things, and or little tips for them to just help quickly, and if that's not working, when to refer. And the main thing we wanted them to learn is to refer, because we realized most of them are not interested in learning breastfeeding. They don't have time for that. They're not going to get reimbursed for it. But we do want them to refer, and that many people don't refer, quite frankly, because they don't know it's a problem. So something as simple as like cracked, bleeding, nipples, painful breastfeeding is not normal. That's all that we would like teach them of like, if somebody tells you it's painful to breastfeed, if somebody has anxiety about breastfeeding, if they have cracked, bleeding nipples, scabbing, bruising, blisters, refer. So that they're just like, oh, okay, I see a blister, or I see a bruise, or I see scabbing, I'm going to refer, and I have my referral sheet, so now I know what to do. I just send them to these people. I don't need to take time in my office that I don't have time for to help this person with breastfeeding. And, because I'm not getting reimbursed for it, and this is going to open Pandora's box, and I'm not skilled for this. And so really kind of helping them to figure out how to address it, as well as connect them to appropriate resources. And next slide. I think that should be it. So just to wrap up, one of the other things I just wanted to point out, because I heard people mentioning in some of their things about how to address rural areas, is one other idea too, which we have had at one of our providers in Kaiser, is that we identified a provider champion. She's a women's health nurse practitioner that was interested in breastfeeding, and she sold it to Kaiser to pay for her to become an IBCLC so that she could be the expert in her, so that she could be an expert for her community and company, as well as bill for that. And then that helped eventually lead them with furthering opening outpatient lactation consultant services with the other people that joined her, because they could bill for that. And so just thinking about, if in some of these rural areas, identifying someone that their employer might invest in them to help have people that can bill for those services and be an expert within that rural community can also be helpful. So that's what different things we've done, and that's it.
Great, thank you so much. I know we're over time, so we're gonna have to skip questions for now. So just quick next steps. We invite you to save the date for the ASTHO Breastfeeding and Early Life Nutrition Innovation Sustainability Convening. It will be on July 30th and 31st in Asheville, North Carolina. The goal of this two-day meeting is to enhance the capacity of grant recipients to successfully collaborate with partners and to help better identify their needs through level forming and silo busing techniques. Travel for teams will be paid for by ASTHO. More information will be shared shortly. Finally, we ask that you make sure to fill out our evaluation. The link is also in the chat box. Again, your feedback is really important to us, so please do fill this out. And with that, we would just like to thank everyone who joined today's webinar, especially our presenters and partners. And as always, please reach out to the ASTHO team with any questions. You can find our emails on the page in front of you. Thank you, and have a great rest of your day.